As discussing facial beauty. My disclosures don't relate to this program or this lecture. And I'm talking about beauty. What's this all about? This is People Magazine's last year, the most beautiful woman and sexiest man alive. What is it that draws us to them? This is this year's same thing. You have similar features, but a little later, what draws them? What makes us universally agree that these are the most attractive people? They've actually done studies showing it's not just unicultural. They've had people from different cultures look at a third culture, and they universally will pick the same people as being the most attractive. Children as young as 3 months old will actually focus more on an attractive face than an unattractive face. So it's not just learned or taught or media in part. It's really more something that may be innate, not just cultural and evolutionary. So what is beauty? Definition of the Oxford English Dictionary is a combination of qualities that delights the sight or other senses. What does that mean? Webster Dictionary says the quality of aggregate qualities that gives pleasure to the senses. So basically, they're talking about feelings. We're not talking about anything you can define. So you really can't define what is beauty. But to quote Aaron Spelling, famous producer, he said, "When I can't define it, but when it walks in the room, I know it." And you know it too. You'll be sitting there and you'll be walking into a room in your reception area, and you know that all of a sudden you're drawn to this face across the room that's to your peripheral vision, and you know this is something that's extraordinary. Historically, they've equated beauty to mathematical thing, the ancient Greeks. On the right, you have Da Vinci's Vitruvian male, which is supposed to be ideal male, and they talk about symmetry, and they keep hearing about symmetry. Mark Hart has the golden ratio, which has he takes the ratio of 1.6 to 1, the lower lip to the upper lip, to the eyes to the nose, and that is again the ideal ratio of beauty to construct the ideal beautiful face. And we talk about that, and everybody talks on beauty, every textbook says that, but I think they're wrong. It's more about the ratios of facial features. This is Vogue magazine from March of this year, and these women made their way to the cover of Vogue magazine. And the vast majority of them have significant asymmetry, as do our patients. Look at this lady. Do you think her asymmetry affected her career? Her right cheekbone is higher, left cheekbone is broader, her right brow is higher, the corner of the mouth on the left is much lower than the right side. It hasn't affected her career. Let's look at her mirror image. Now, why are mirror images so important to us? Because we're living in the selfie era. So people are walking in, and you treat them, they walk back, come back, a week later, say, "I'm unhappy, I look crooked now," and they whip out their phone and show their selfies. Selfies are actually photographs, and we're used to seeing our mirror image. So what you see every day, it doesn't have time to brush your teeth, brush your hair, shaving, put your makeup on, is a mirror image. When you reverse it to a photograph, it looks bizarre. When I have patients come in for facial surgery, I'll reverse it and people go, "Oh yeah, that's me," but their husband or wife say, "That's weird." So we're fighting selfies. So what we need to do is, first of all, photograph every patient and point out asymmetries, because these are very important. To quote one of my professors said, when you point out something before you treat them, is an explanation. When it's after, it's an excuse. Here's her right side of the face duplicated, left side of her face duplicated. Is one more attractive than the other? I think her original is more attractive. What we're really talking about is attractiveness. Where's the actual origin of attractiveness? It's evolutionary, Darwinian, and how our faces have evolved. The sexual dimorphism between males and females are really about finding a suitable mate. What's going to make you want to procreate and attract yourself to somebody? In females, it's having high estrogen, low androgen. That symbolizes fertility, hip to waist ratio. In males, higher testosterone. Males are the hunter-gatherers. The ideal feel in the face, largely spaced eyes, small nose, high cheekbones, thin jaw. This actually has wider. She has more masculine jaw. I just picked it because everybody talks about her, but her jaw is a little more masculine. Small chin, small upper lip, and full lips. They actually showed that women with lipstick, men tend to focus on their red lipstick on their lips longer than they do if they don't wear lipstick. And Where do you find this? In the dolls. This is what the Barbie, big eyes, small chin. This is exactly what the ideal beauty is that the toy industry has known for many decades. How about the male dominant traits? We have a strong brow, high cheekbones, angular jaw, full chin. This is the hunter-gatherer. These are the strong, what this does is theoretically protects your eyes and mouth in battle. So this is someone who could provide for your family, someone who will make a good mate. Yet if you over-exaggerate these, when you look at the villains, they tend to have over-exaggerated features. They tend to be people with high testosterone, your criminals. Again, needed for too many attractive women. This is for you ladies. Again, we're looking at these men, low horizontal brows. I think brow lifts are overdone in men. Thin eyes, strong cheeks, angled jaw, and of course, don't forget about smiling. Beauty is about how you're perceived. And they've done studies that are showing people are always perceived to be more attractive when you're smiling. It gives you a glow, it actually attracts some people to you, they'll react differently to you. So again, you're patient someone, no matter how attractive you are, if they're pouting, they're not going to look good. Concepts of beauty actually have changed over the many decades. You have the 30s on the left, high, thin brows, a smooth forehead, very small eyes. And you get into the 50s, eyes have become more prominent, bigger eyes, fuller, lower brows. Get into the change into the new millennium, and again, your beauty has changed. So it's not no absolute concept of beauty, but you can see they all have the similar ratios. Current trends, it's not about any specific ethnicity. It's multicultural. Eyes are getting narrower. We have stronger noses, plumper lips, and ethnic beauty. Again, Beyonce, she actually has features of multiple ethnicities. This is what makes her the most attractive across a universal group of people. So what are the most frequently assessed facial features? They've done studies, when you track, you tend to look at the eyes 32.8% of the time. Nose is second, then the mouth, ears, and chin. So for example, as a rhinoplasty surgeon, if someone has a big nose, it takes away our attention, and we don't see the beauty. Once the nose fits the face, it's more attractive. So basically, for beauty, we want to frame the eyes. That's what it's all about. Here's a young lady on the left. Again, she's concerned about the cheeks, the eyes, the temples. And how do we frame her eyes? By augmenting your cheeks gently, by subtly raising her eyebrows with toxins, by filling her tear troughs. What we're doing is we're enhancing the beauty by framing and enhancing her eyes. Again, from three-quarter view, smooth transition with the lower cheek, with the eyelid, opening up very slightly, about a millimeter, but just that beyond to change her from attractive to extremely attractive. Again, big eyes, but the hollows under the cheeks, the hollows of the frontal area, of the cheek area, it's taking away from those big, beautiful green eyes. You enhance them by treating the cheeks, treating the tear troughs, slightly opening up her brows, change it to another level of beauty. Again, from the lateral view. So what we want to do is, again, we're framing the eyes. Even males. Now, males are different. Ladies, they want more arched cheeks, what I call the runway cheeks. As we get older, women want more anterior, more volume, restore the lost volume in the cheeks here. Men definitely want to keep it filler more anterior. You don't want to feminize a woman. Feminize a man. And there are cultural differences. I have patients from China, a lot of students in New York, they want their cheeks down here. They want just below the malar eminence. Korean ladies want more anterior. Caucasian, more arch. So it's slight cultural differences that frame their eyes differently. Again, you can see by improving the contour of the cheek anteriorly, you're making him a more attractive male. Again, less of that brow. The brow looks like it's overpowering. By framing the lower eyelid and cheeks, you're improving his appearance. Conor Field's law of averages, and actually, we're attracted to average. They took numerous facial features and averaged them out and see what people look at. They actually showed most attractive people, and they found that that's not what the average person is attracted. It's the averageness, which is you're finding your ideal mate. So it isn't the most attractive person that necessarily is best for you. It's someone who has an average of most attractive features across a spectrum. They say he's the male face of the future. Again, back to the Beyonce picture. This is multicultural. He has slightly narrower eyes. He has the low, full brow. And this is where they think the face in 3000 will be as we evolve, and the beauty selects out what are the most attractive universal features. Since we have, again, people are multicultural, there's no boundaries with cultures anymore, this is where the face may evolve. But don't overdo it, like the housewives of everywhere. So, little is good, more is not better. So, 2 cc's, 3 cc's of filler may be good. They think 3 is good, 8 is better. Well, there's an old saying in cosmetic surgery, you can do more, it's harder to do less. Or we took a class of beauty and brought it to the present. Well, this is what they look like. So we're trying to avoid this. Again, another onus on us as treating with fillers and toxins, Alicia Keys and the no makeup movement. No makeup to highlight your features. What we're doing is we're actually needing to use our fillers and our toxins to now do the highlights that she otherwise would do with contouring, with rouge, with various makeup that she no longer wants to use. So to enhance beauty, what do you want? Frame the eyes, is number 1. Women, higher cheekbones, men, more frontal fullness. Look for asymmetry in your patients. Maybe treat one side more than the other. Make sure you photograph so you can document that if they come back and they're unhappy to treat this, because they're looking in the mirror 40 times a day after you treat them instead of only 12 times a day before you treat them. Don't overdo it. You can always add more, it's harder to do less. Thank you.